So how do I know if this is the thing that I'm dealing with?
Yeah.
Because a lot of people will feel that pain in the front. A lot of people look at that C sign. We make a C with your hand and put your pointer finger and middle finger on the front of your hip. That's called the C sign because a lot of people will go, ooh, I just have pain right in here. And they'll kind of point to the front of their
deep.
Front of their hip, and it's deep. Welcome back to another episode of the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about labrums of the hips. How do they tear? What are they? What do they do? And why is it so darn painful sometimes when we have injuries to this thing? Stick around.
Now, before we really dissect, what is a hip labrum and what causes this to kind of happen and what can you do about it? What does it feel like? We did do an episode on hip impingement that I think is really important, FAI. So go take a listen to that one. And especially if you're having other hip issues, we've done a ton of videos, me just personally myself showing some exercises that you can do. So if you haven't subscribed yet, please do, and just hit the little bell so that you get the reminders when something new comes up as well. And then comment below if there's ever anything that you were like, you know what, I haven't seen you talk about this, or I haven't heard this podcast from you guys. Just let us know in the comments below. I kind of want to talk through what is the hip labrum.
Labrums are something that gets talked about all the time, but no one really knows exactly what they are or what they do, what the function of them are. But we hurt them a lot as humans. The ones talked about the most are in our hips and in our shoulders.
Yeah.
There are other labral-like structures around the body, but really what they are is these little suction cup-like things that go around the rim of the joint in our hip that help the ball fit the socket a little bit better. Yeah,
and it really just helps with that overall joint stability. So think about it kind of helping with that joint lubrication, making sure that we're kind of increasing the contact area within that whole joint itself, and really just acting as a shock absorber. Wow, I can't say that word. Nope, not happening.
Hips, obviously very important to balance. So if we have issues with our labrum or if we have any labral degeneration, it's going to affect our body's ability to feel steady or have balance. So that's something that a lot of people will notice.
We can get tearing in different parts of the labrum as well, which is what we're going to talk about.
And so how does this happen? I think it's kind of funny because when you look at all of the common positions that you tear the labrum in, it's basically if you take your leg and put it in any extreme motion, because as soon as we start rotating, we're putting a little bit of tension on that labrum, or we're putting it at risk of being kind of pinched between our femur, the neck of our femur, and the acetabulum, or the rim of that acetabulum. So it's always like, oh, well, if you're way extended in your hip and at a lot of external rotation, you might be at risk of tearing your labrum. And then there's a few other positions, but those are actually what we call close-packed positions of the joint, where the joint has a lot of tension in it. So any position you get into that you feel like that hip is just way wound up, you're probably putting a lot of pressure on the labrum.
And hip extension, external rotation, we can think about that as a dancer or a gymnast. When you get into this extreme rotation, so that the leg behind you and then the foot or the knee facing out. So that's extension, external rotation. And that's like a split jump that you might do, or kicking your leg back behind you. So if you're always putting your leg into that position, it's just putting a lot of stress and strain on that joint. And if we don't have good hip rotation in general, it's going to put even more pressure in one area of that labrum and kind of cause that tissue damage in that area.
A split jump, which I demonstrated very nicely in our last podcast. So hopefully
we can get that split jump in this YouTube video.
Hopefully our editor throws that in this YouTube video just for your comic relief.
Guy's gonna be like, what is happening?
When we start talking into symptoms, okay, so how do I know if this is the thing that I'm dealing with?
Yeah.
Because a lot of people will feel that pain in the front. A lot of people look at that C sign. We call it a C sign, where if you make a C with your hand and put your pointer finger and middle finger on the front of your hip, so you kind of turn your hand down, that's called the C sign, because a lot of people will go, ooh, I just have pain right in here. And they'll kind of point to the front of their
deep.
Front of their hip, and it's deep. And that actually means, generally means it has to do with deep joint type structures. So then we look at FAI, we look at something that might be happening with the labrum, we look at some of the muscles that kind of attach deep in that area. And so people will have the C sign and they'll say, ooh, it's a real deep, dull ache. I sometimes have this pain at night. It happens a lot when I rotate or I pivot on my feet.
You're probably going to hear a little bit of like clicking and popping that's happening. Maybe you feel like it gets locked up sometimes. That could be an indication of some labral stuff happening there as well. Especially look out for it when you're doing activity, but also it could be associated with just like prolonged sitting, walking for long periods of time. And so that's why it's also like there's so many factors to take into place here. And that's why going into the treatment and kind of seeing, okay, is this feeling better with conservative treatment? Is it feeling better when I start to actually do some of the things that we're going to talk about?
Yeah. And when we talk about treatment, so labral structures aren't ones that necessarily heal really well,
right?
Because they don't have a great blood supply. We talked about how they're fairly highly innervated, but they don't have amazing blood supply. So they don't heal super well on their own. And so then the question is like, there are surgical options, of course.
Yeah.
And then there's the conservative options. And there's really decent evidence for either route, depending on, again, how you kind of get triaged by a doctor or an ortho, because there are some instances in which conservative approaches have a lot of merit and can be really successful, especially if you're not getting really severe locking of the joint, or if your pain isn't to the point where it's unbearable just from walking.
So we really want to start to manage pain control. So we don't want to be pushing into any areas like the hip extension and rotation that is going to be causing pain. If we're wanting to kind of back off to decrease those pain sensors just in the brain in general, then we need to kind of control the pain levels that we're having at the moment. And so that might mean limiting those extreme ranges of motion, backing off of that extreme activity. We could still do activity. We're still going to do movement. And then really starting to understand this trunk control and stabilization, which is something that we talked about in episode 50 a lot as well. We get asked about snapping hip syndrome and why do my hips click and pop? And this was one of the reasons that your hips can click and pop. And going back into that episode, we talk a lot about the core control and what that really means. And we talk so much about this in our Gen Health and Optimal Body communities as well.
You'll talk about anterior pelvic tilt or posterior pelvic tilt, or are my ribs kind of flared out, in the front? And how do I make sure I'm always aware of what those are doing in relation to each other? Because if the pelvis is always in this anterior tilt, that affects what the hips are doing, and that affects the hip labrum, which is why we always go back to core control if we're ever talking about the hips or the shoulders, because they're so intimately involved in our core. So the first thing is getting on your back and doing something like supine marches. And can I control that supine march with still having good control of my hips, my pelvis, and my rib cage, so those aren't just continuing to move as I move those legs. If you lay on your back and you try to just do a nice and easy supine march and you notice your hips are all over the place, that's a good sign of, hey, when I'm walking, I'm probably not controlling my pelvis that well.
We've been taught poor cueing when it comes to core control. And a lot of times it's like, pull your belly button back to your spine. But if I suck my belly button in, all I'm doing is pulling the pressure up and down, so into my pelvic floor as well. But I'm flaring my rib cage a lot. So that's actually not a good cue. And something like, even if you're just sitting and listening right now, even if you're sitting in your car, something you could do, place at least one hand, if not two hands, on the sides of your rib cage and try to take a
Both hands, drive with your knees. Drive with your knees.
One hand if you're driving. And try to take a deep inhale from the sides of the rib cage and then a really long exhale, keeping the shoulders upright, but allowing that rib cage to move to the side and then contract and lower as much as possible. And you'll notice when you do this, it kind of forces you into a better quote unquote posture. Just pumping that diaphragm more gets your body in a more aligned position. And then that's a first place to start, just starting to use that diaphragm. And then we go into, like Dom said, with those marches and stuff. Now, how do we control that rib cage diaphragm with the pelvic floor and what we're doing when we move our leg? This goes deep. And that's why it's not just do some planks or do some sit-ups. That is not trunk stabilization. That's not trunk control. Trunk control is truly understanding this relationship from the diaphragm to the pelvic floor and how it works when we move our arms or our legs.
Then we have to try and figure out how we can control our hip through all of this range of motion. And we're not going to go to extremes right away, but starting out with like minimal hip circles.
Yeah.
It can even look like you're just standing and you start by kind of finding that core stability, and then you bring your leg a little bit forward and kind of rotate it all the way out to the side, come kind of back, maybe go into a little bit of extension or just keep it in neutral, and then back to center.
Or you can do it on your back too.
Yeah, you can do it on your back. You can just let your legs kind of slowly go out to the side into some of that external rotation, which may have been aggravating before. but again, maybe not to the extreme range, and then back to the center. You don't even have to bring your feet off of the ground to start. So things like that are going to start getting your hip moving in different directions with that core control, so that we can start programming. Okay, when I move this hip, I keep my core somewhat more activated and stable, so that once you get back to doing things like walking or running and doing activities, you're going to have a little bit more of that programmed in.
Mm-hmm. And then we want to make sure that we're getting into strengthening as well. And this is where it's like, okay, let's get into a range that doesn't feel aggravating for my hip. So a lot of times, the basics are going to be side clamps, but sometimes that is kind of putting your hip in extension and then external rotation where it might not feel good for you. So maybe we have to modify how we do a side clamp, or maybe we're going to the wall, laying on your side, and then going really close to the wall so you don't have a lot of extension, but your legs straight. You get into that core control, that rib cage pelvis alignment, kick your heel back and point your toe to the ground. Now we're going into a little bit internal rotation, but we still get a little extension and a little muscle building in the glute area. Can we do bridges? Maybe we're doing soft bridges. Maybe we're doing our heels on an elevated surface and just lifting into a modified bridge where you don't have to go into full extension. So we start to play around with how can I get into isometric control and contractions before I get into movements like squats, like lunges, and really firing up under load. But how can I do it where I just start to feel the muscle and I don't have any pain or aggravation?
Right. So as we start doing strengthening in a comfortable, kind of tolerable pain level, then of course, generally that pain level will start receding or staying about the same. And then we can start moving into a little bit more range of motion, so that we might get to what we would call more normal range of motion as we had before, but we're not noticing that we're having as much of that pain or catching from the labral issues.
Now, if we're thinking of sensory, we're thinking of balance type stuff. So single leg balance work. Maybe we're throwing a ball on a single leg, or we're doing something that kind of is distracting you, and it's making that joint and those muscles around that single leg from the hip all the way down kind of work, and the core control kind of works into that as well. So getting into some single leg balance work, maybe getting into eventually some single leg deadlift type work, and reaching in different directions. Like, this is all part of starting to program in different directions within your hip, strengthening and proprioception.
And along with that, just doing basic things like lunges and squats. Yeah. Because then you're doing it in more of a controlled pace. Because then after that, the next step is, how do I start returning back to the activities sport, or the sport that I want to be doing? So then what kind of plyometrics are you going to be adding in? Which I like starting out with even just a little drop, a squat where you're kind of up on your toes and then you drop into a squat, or going onto a little step and then dropping into a squat, because that's going to reintroduce that impact that may have been real uncomfortable on the hip. And then doing other things like agility, if that activity you want to get back to has you changing directions, like how can we work on side shuffling or doing, different ladder drills, stuff like that.
Thanks for joining us on another PT Pearl from the Optimal Body Podcast. I hope you enjoyed this. You learned a little bit more about your hip, or maybe some areas that you might need to add into your hip a little bit more. Because remember, if we do all of these things that we talked about for healing, and you do it for prevention, you help to prevent it. So leave us any comments. What are you going to add in? What do you want to learn about more? Let us know so we make sure that we're giving you what you need.